some kind of continuing education unit and training every 5 years. So so teachers, administrators, and it must be free. Teachers and administrators must get some kind of suicide prevention every 5 years with that bill. After that, and that was, this has been in effect since the 129th General Assembly, which is somewhere around 6 or 7 years ago. House Bill 149, which was the 130th General Assembly, so it was, 3 or 4 years ago, actually designated September 10th every year as Ohio Suicide Prevention Day. So we have, Suicide Prevention Month being September, and she wanted to create a special day in Ohio that would focus solely on suicide prevention. So this bill, House Bill 149, was passed by the 130th General Assembly, and so every year we recognize September 10th as Ohio Suicide Prevention Day. I know that there are some communities that do some events and some programming around that day, and so that is in Ohio law that this day is enacted as that. House Bill 28, which has a little more teeth to it. Some of the issue with any of these bills is that there is not funding around any of them. So, the free training has to be, the free training, doesn't come with any money for anyone to actually give, any organization to actually give the free training to the schools. There's no money around doing anything around Suicide Prevention Day. The same goes for public institutions at higher ed. So what that House Bill 28, which was just a few years ago, created crisis intervention. So colleges and universities have to have a page on their website that is in the forefront, that it can be found publicly with ease. And what the web page must have on it, according to the language, is that they have to have national, state, and local hotlines. They have to have information on availability of local mental health clinics, counseling services, what is not only at the university, but in the towns and cities that surround universities. They must have multimedia, so an app access. So each college must have an app for smartphone and other devices, tablets and such. This bill also says that each college must have an outreach plan regarding suicide awareness and prevention materials, and this all has to be listed on their website. And then also, the university must have a postvention plan. So if a student does take his or her life, that there has to be some kind of plan to communicate effectively to students, parents, and staff after a loss of someone. I have looked at a couple of sites since then, and it's something that you can do as well. If you live in Findlay and the University of Findlay is there, is there a page that references suicide prevention? And if not, technically they're in violation of House Bill 28, which is now law in the state of Ohio. I wouldn't go at a college at all saying you're in violation of a law. I would instead go, hey, I know House Bill 28 was passed. Is there any way I can, we can help you out? We can, work together on making sure that this page is created. Basically, this is a good opportunity to establish relationships with colleges, especially the wellness folks at each university or college in the state and in your community. So this is a law, and frankly, it was hard to find some of these pages on some of these higher education schools to find. So this is something that I think we'll be looking at and trying. We may even have at one of our coalition in-person meetings, maybe have a college or someone from a university setting come and talk about what they have done around suicide prevention. But this all has to be on their website for anybody to view. So there's also Senate Bill 159, which creates a license plate. And what's interesting about this is it really doesn't have to say it's not a suicide prevention. It's a school license plate. So she created this to the private schools can actually apply to get their own license plate. So some of the schools that have done that are Gilmore Academy, Hawkins, Padua, or Padua, St. Albert the Great, St. Edward, St. Ignatius, St. Xavier, University School, and Walsh Jesuit. Those are mostly, from what I understand, in Cleveland. But what happens with this is every plate that they sell, 50% of the fees have to go back to the school for mental health services and for mental health prevention, for mental health care within those schools. So you won't find a suicide prevention license plate per se, but every time you see one of these high school plates, and I'm talking about high schools or private schools, that actually contributes to mental health services at that local school. So they're allowed to take some of that and help supplement their existing efforts at the local school. Now, the next bill is House Bill 64, and we're getting to it. So there was money put in this bill, and this was the main operating budget a couple years ago. It's not the most recent one, where they did put $2 million appropriation for, actually it's 4 years ago, $2 million appropriation for suicide prevention, and it created a website called suicideprevention.ohio.gov. Which has a lot of different resources and things around suicide prevention. She wanted a local or like a uniform site that anybody can get into. And she also put in there, and this was passed, an additional $120,000 in each fiscal year to Northeast Ohio Medical Center. Northeast Ohio Medical University, so NeoMed. And they actually do a really good job and are always looking for folks to help get suicide prevention resources on college campuses. They have money to provide resources for different colleges and universities across the state. So this is another opportunity that we could work with our colleges and universities, contacting NeoMed, which is up near the Kent, Ohio area, and I think it's actually Rootstown there. But this is a great opportunity that we could work with our local colleges, say, work with NeoMed to help them give resources to, again, using University of Findlay as an example for no reason except it's, for whatever reason, University of Findlay is on my mind. But getting them resources that would be free of charge to colleges and universities. So that's the biggest budget item that we have that we've had in the last 5 or 10 years, and probably forever. But I haven't looked back in the annals of Ohio law around suicide prevention. There's also House Bill 440, which is Ohio Survivors of Suicide Loss Day, which is the Saturday before Thanksgiving. And it's designated as Ohio Suicide or Survivors of Suicide Loss Day. And it was created to help folks have a forum to join together for healing and support to cope with the tragedy of losing someone to suicide. Again, it's an official day here in the state of Ohio, and something that is really can be powerful if communities decide to honor this day. The other thing that one of the last bills that she passed while she was still in office was the very first bill, House Bill 453, which mandated that schools and universities, or I'm sorry, not schools and universities, schools require suicide prevention training every 5 years. One of her last acts was, now it has been reduced from 5 years to 2 years. So schools now have to get suicide prevention training, and this is employees, not students, every 2 years to help identify signs or to help, kind of a, could be QPR or whatever other kind of program that are out there. So this is what Representative Yelsky has. Someone asked the question, is there a cost to the school to apply for the plates? I think there is a small cost to apply that goes to the BMV, but I guess it more than pays for itself, because when someone orders a special plate, there is a $30 to $40 upcharge that then goes back to the school. So it is a way that schools can actually raise a little bit of money around suicide prevention, especially if you have an active alumni base or something like that. It's a good way to raise money for each school for mental health wellness in the community. So thank you so much, Angela, for the question. So so let's go into what's going on right now in the state of Ohio. House Bill 123 has passed the House, and there is a quick kind of overview, and I know that Michelle, after this, will be sending out a recording of this webinar to everybody who's on here, so you don't have to try to take notes on this. You can watch this at your leisure, and turn down the sound so you don't have to hear me again. House Bill 123, it's actually called the school violence bill, and two parts that we really wanted to highlight in this was that there is a training component that suicide awareness, prevention, and social inclusion. There must be a list of approved training programs in suicide awareness on the ODE website that schools will then be able to use. It doesn't mandate that they use any of those, but there has to be at least 3 of those on their website that are evidence-based, that have some research behind them, and they have to provide 1 hour or 1 class period per year in those 3 areas. So they have to have 1 hour per year for students on suicide prevention. There's also a student-led violence prevention clubs, which would require schools to set up student-led violence prevention clubs, where they have, some of the things they'll tackle are suicide awareness, violence prevention, dating violence, social inclusion, and all of those subjects. Now, this is not passed yet, and we, myself and John Ackerman, Dr. Ackerman from Nationwide Children's Hospital, testified on it a month or so ago, and they have not had another hearing yet. We're hoping that this will pass. It passed through the House, and then they have to have an opponent's bill, or I'm sorry, an opponent's testimony, and then they could possibly do a vote. but that next hearing has not happened yet. So it is something that, as you look at, and this is in the Senate Education Committee. So if your senator is on the Senate Education Committee, ask about the status of this bill. What's going on with it? What are some of the, maybe even what are some of the concerns about it, if there are any.
And just so all of you know, I will be sending out an email with this recording and some information on all of these bills. And I do have the information of all of the people who are serving on that education committee so that you can easily find out if your representative is on that committee.
So this is something that we are in favor of, and hopefully we can get this passed in the spring. Things are winding up through this year, through this calendar year, but hopefully something we can get wrapped up. So here are some of the talking points that Michelle has sent out earlier. Importance of universal prevention. It's always good to discuss if media ever calls you, or if you're in front of a group of some kind, the importance of universal prevention. It's also important that we use evidence-based curriculum to talk about suicide prevention in the state of Ohio. And then finally, about having a consistent yearly curriculum that we, many schools do have. Programs like Signs of Suicide. I know up in Cleveland, Life Act is a big provider. There's sources of strength and different pieces, different programs that are out there. But we really want to encourage that schools make this part of their yearly curriculum, their yearly routine of getting suicide prevention into the hands and of teachers, so that they can also share that with students in the school. Another bill that's going through right now, in fact, the latest hearing was just yesterday, was Senate Bill 121, which is health education standards. Ohio is the only state in the nation not to have any health education standards. Every other state does, including Missouri, which always seems to be, for whatever reason, behind. They even have health education standards. And if you're from Missouri, I don't mean to slam Missouri. It's just it is kind of an interesting state that always seems to lag behind a bit. But however, we are the ones who are lagging behind now. Basically, what health education standards would do would set a set of guidelines that schools would have to measure up to as they're providing health education. It sounds pretty easy as far as wow, who can be against teaching health? Teaching health education. That doesn't sound like there'd be any kind of issues with that. However, there are, this is a very, very controversial bill, because part of the bill, and Stephanie Coonsey, Senator Coonsey is a Republican, and Senator Sykes is a Democrat, so there is bipartisan sponsorship on this bill. However, what's in there, and this is where there is contention that is going on with this bill, is that there is also included some sexual health education. So talking about STDs, and that has come that's come under some fire. Especially, they've got a number of parents coming out against this bill. Who are conservative, or who have some beliefs, religious beliefs around this. And this is appealing to some of the more conservative members of the Senate Education Committee. It's under the same committee as the House Bill 123. So I don't know if this bill is ever going to move, and if we're going to have this, because this has been stuck. I think they've had the 4th or 5th hearing was yesterday. They're all testimony. And, soon there's going to have to be a decision about whether there's a vote taken or whether they just let this bill die in committee. We have written testimony and sent it to Senator Lehner, who is the chair of the committee, in support of health education standards, especially to provide mental health in those health education standards. So we are in support of the bill. Frankly, I really think we do need some health education standards so that we know that students in Gallia County might be getting the same, are at the same standards as East Cleveland, and youth and students in Lorain County are getting the same health education as other students in Paulding County. So it doesn't tell schools what to do, but instead gives them kind of a bar to work from on how they educate. Again, understanding that there are some who are concerned about the STD component of this, but we really think that having some kind of health education minimum is very important to the state. And again, we're the only state not to have it in the entire country. House Bill 12 is another, and this actually passed out of the Senate committee yesterday that it's in. So the full Senate will vote on this probably either later, in the next week or so, or early next year. This would establish something called the Ohio Children's Behavioral Health Prevention Network Stakeholder Group, which I don't know how the acronym is going to be for that, but this group is going to be created. It has a number of different entities that would be required to serve on this, including NAMI, someone from the Board Association, the Academy of Pediatrics, the school board, and the governor's office. There's a young woman who leads up the children's initiative, the kids initiatives, in Governor DeWine's office, and she would be in charge of naming who those members would be that would serve on this, and this would require the stakeholder group to prepare recommendations and around children's behavioral health and submit them to the governor of the General Assembly. So this is passed the House. It'll be voted on in the Senate. I expect this to be passed into law early next year, and it's something that could be an opportunity to chime in on. I'm guessing the way that these task forces usually go is that they'll probably have some kind of listening tour where they'll go community to community and hear what ideas folks have in local communities. So this could be another opportunity that we advocate for suicide prevention in these bills. Talk to Representative Manning, who's one of the sponsors. He is very, very, he has a personal tie to suicide in his life. So it is something that's really, suicide is very, very important to him. And we really, we really are in support of this bill and hope that there can be, within that report, some recommendations around suicide prevention. So there's also House Bill 315. And House Bill 315 has not gotten a hearing, and I don't expect it ever will. But I wanted to bring it up simply for, it's not only an interesting commentary on where we are around firearms and things like that, but basically, and also Representative Liston is a Democrat in a very heavily Republican House. But House Bill 315 would mandate gun shops to provide suicide prevention information at their counters, and it's not had a hearing yet. It is something that I've had conversations with the Buckeye Firearms Association, and they are really have come out strongly against this. Not that they don't believe in suicide prevention, but instead they don't want to be mandated to do this. There's a number of other co-sponsors. However, they're all Democrats, again, in a very highly concentrated Republican House. So I doubt this ever has any legs. But what we can do, in my conversation with the Buckeye Firearms Association, we can do some things ourselves, and they are open to individual gun shops providing information. One of the things that we are talking about, the Buckeye Firearms Association, is creating a website or some kind of information portal for gun owners only. It wouldn't have the suicide, OSPF's logo on it or reference suicide, but somehow it would be created strictly for gun owners, and in a way that's not threatening, in a way that's not getting into some gun debate or anything like that. We kind of want to follow what New Hampshire has done, and we also, we do have a good pamphlet that the Ohio Mental Health and Addiction Services has just a boatload of these pamphlets. If you want to work with and I know that other communities have done things like gun locks and through their gun shops. So there are opportunities for us to advocate for suicide prevention, but getting it done through the legislature is not the way that we're going to do it. We have to work with individual gun shops and individual gun owners to probably make anything happen. And I'm going to let Michelle talk a little bit about what I would love to see is the New Hampshire Gun Shop Project really come to fruition here in the state of Ohio. So I'm going to let Michelle take it away.
Thanks. So first, I would like to know if there's anybody in the chat who is familiar with the Gun Shop Project. And if you are, could you please let me know in the chat if you've tried to implement or if you have successfully implemented it in your county. I know in my previous role, I worked with my local coalition that I was chairing at the time, and we attempted to do this project and contact our local firearms, like the ranges and the gun stores, to get this moving. But unfortunately, funding just wasn't available for us to really get all the materials that we needed, et cetera. So that kind of fell flat. But what New Hampshire has done, first of all, in 2009, they had, in a very, very short period of time, they had 3 separate individuals die by suicide, and they all 3 had purchased a firearm from the exact same store and had taken life within hours of purchasing that firearm. And so they decided to do something about that. And the cool thing about it is it didn't come from a suicide prevention coalition. It didn't come from like a mental health board or anything like that. It came from their firearm safety coalition, which I think had been in existence since 1994. And they decided that this was a real problem. There were, it was the #1 cause of firearm death in New Hampshire, and the same is true here in Ohio. It's the #1 cause of death by firearm, and suicide is the #1 cause of firearm death. Does that make sense? I think I just made sense.
More than homicide.
Yeah, it is the leading cause of firearm death is suicide. they decided to create this pamphlet, and it's really wonderful because it promotes the 10 Commandments of gun safety. And I guess I'm not a firearm, I don't own firearms, but I know lots of people who do, and they're very familiar with these 10 Commandments or something very similar, which talks about, you know, safely cleaning your firearm, storing your firearm, how to, you know, when you're at the shooting range, how do you behave, things like that. But they added this special 11th commandment, and this 11th commandment specifically talks about consider temporary off-site storage if you or someone in your family may be suicidal. And it's that simple. That's really what the brochure is. And then on the back of the brochure, it also had some information about you know, local hotlines if there was an issue with suicide or someone needed help. And the firearm, like the gun store owners and the gun range people, they would just have those at the counter. And they were also trained to identify a customer that might be in distress. And in that case, if the gun shop owner decided, you know, I'm not really comfortable selling a firearm to this individual, you know, they could make that decision. And there were a few success stories from this where there was one individual who had tried to purchase a firearm. The sales clerk didn't feel comfortable about it. And a couple weeks later, they had received a phone call from that gentleman's lawyer, and the lawyer was like, hey, I just want you guys to know that you saved my client's life. He came there to purchase a firearm because he was suicidal, and you didn't sell it to him. So it's not just about putting a brochure on a counter and hoping people will absorb the information. It's also about training people on how to identify the signs so that they can help each other and hopefully, you know, get help for the people who are struggling in those moments. So this shouldn't come as a shock to most of us, but why does this even matter? And really, first of all, firearm death, or firearm, hold on, why am I? Suicide by firearm is the #1 cause of suicide, or death mechanism in Ohio and in the nation. And again, it was true in 2009 for New Hampshire as well. Now, and that's true for both male and females, although males, more than half are dying by suicide with the firearm being the method. Now, according to the recent Ohio Department of Health report that came out a couple weeks ago, from 2007 to 2018, the number of suicides by firearm increased by 48.5%. So in numbers, that went from 647 people dying by suicide by firearm in 2007 to 961 in 2018. Now, in 2018, we lost 1,836 individuals to suicide in the state of Ohio, and 52% of those were by firearm. So that's why this matters. We're not trying to enter into any sort of a debate. We're just trying to keep people safe if they own a firearm. And so seeing something like this, whether it's mandated or not, this is something that coalitions could easily, you know, get on board with, you know, contact us or contact the Ohio Department of Mental Health and Addiction Services, get some of those brochures, and talk to those people. I mean, maybe you know the guy who runs the gun shop in your community. Work with them and talk to them about why this is important. It looks like there are some people in the chat who have partnered with several shops throughout their area. I know up in 4 counties, up in the northwest corner of Ohio, they're partnering with them. So thank you, Tony. And Crystal Rankin says that they're contacting firearms dealers and providing them with firearm suicide prevention rack cards that came from the Buckeye Firearms Association. So it looks like there is good work being done around this in local communities with coalitions. And we'd like to encourage that, again, whether it's mandated by law or not.
Thank you so much, and yeah, thank you so much for you know, for Tony and Crystal for sharing that. And it is so important, and it really encourages us here at OSPF to hear those good news stories that you know, this work is being done. You know, frankly, right now, the governor's latest attempt to, you know, around to put some rules and such, and I'm being very careful about what I say, because I don't want to turn anybody off or or get anybody upset. But the governor's recommendations have are going through debate right now in the House, and it's been quite contentious, as you expect it to be, around pink slipping folks and some kind of measures around mental individuals with mental health and guns. On the one hand, some folks will say it's a good first step. Others will say it's not enough. So, in all honesty, we've been letting, this is not, it has to do with suicide, absolutely. However, how can we, as this continues to go through the legislature and through the public debates, how can we, as an organization, as a field, work with gun shop owners, work with gun owners, work with farmers? A lot of them do have guns for different reasons around the farm. How can we, veterans obviously have some experience with firearms. How can we work with those populations that do deal with firearms, not be threatening? We aren't trying, nobody's trying to take people's guns or anything like that. And instead, always, make sure that our bottom line is we want to save lives. So thank you so much again to Tony and Crystal for your work. And I've just asked for a boatload of these cards as well from the department. And if you need some of those rack cards that Crystal referenced, then, please let us know, or please let the department know, and we'll be more than happy to send them to you. Again, they're branded with the Buckeye Firearm Association. I don't think OMOS's logo is on it or anything, so they're pretty smartly branded, and they come from a gun advocate lens, and it really, they're nicely done. So thank you so much. So one of the last things we want to talk about, not the last, but one of the last things, is I get questioned a lot about the National Suicide Prevention Lifeline. Right now, it is, it's a typical 1-800, I think it's 273-8255. Oh, thank you. Number, and there's hope that changing it to more of a 3-digit number, 988, not 998. So they want to change it to 988. And there's been a couple bills that have been introduced at the congressional level. So this will be a national change, not Ohio only, but it would be a national, every state. House Resolution 4194 and Senate Bill 2661, both in Congress right now, I guess have not been heard, and I'm going to tell you why in just a second. But there's been a lot of senators on 2661 side, and a lot of representatives, including one we worked with, Congressman Anthony Gonzalez from up in the Northeast Ohio area, support 4194. But the FCC chairman, I think his name is Pye, said that he now recommends that the new Suicide Prevention Lifeline to be 988. And so he recommended that to the committee on November 19th. They're going to have discussion and vote on it December 12th. So by the end of the year, we could have knowledge. Now, this would take some time to set up and things like that, but we could have some kind of direction about changing the Suicide Prevention Lifeline to 988. I'm guessing, and this is just, I'm thinking logically, so I don't know if Congress thinks that way, but I'm guessing they would still have, because it's been branded so well, the 1-800-273. But I'm guessing that future branding would be 988. Much like the 911, everybody knows what 911 is, and their hopes that 988 would be marketed the same type of way. So keep your fingers crossed on that, and we'll let you know if that does get passed on December 12th. I recently received a report about the National Suicide Prevention Lifeline, Ohio, and it was the first 6 months of 2019, so this was January through June, and 27,228 people from Ohio called the National Suicide Prevention Lifeline. So that's in half a year. That's a pretty sizable number. 73% of those callers were able to receive help, and which means that 27%, or 7,456 callers, were unable to be answered by a local center in Ohio. So I'm trying to understand, are these people who were just not answered? Are they they didn't get the help they wanted?
Sometimes calls are abandoned before they're picked up by the person who's calling. So there's lots of different questions as to what that people who didn't get help means. So we're going to look into that a little bit more.
Yeah, so I'll look into it and let you know more about that as we go. So that's the update on the National Suicide Prevention Lifeline. Probably the last thing I think that we're doing, that I'd like to inform you about. So we got some funding from Ohio Moss and the PEGS Foundation and a couple other organizations to host a suicide prevention conference, a 2-day conference, and we're partnering with NAMI in May 13th and 14th. But we decided to look, when I did some work on the national level, it was a bit distressing to see how many states went without conferences on mental health or suicide prevention. So what we wanted to do, and I've talked to the University of Wisconsin, and they would help promote this as well, we're going to host, instead of just an Ohio Suicide Prevention and Mental Health Summit, we're going to host a Midwest Suicide Prevention and Mental Health Summit. So we not only learn what is going on here in Ohio, but are there things that we can learn from other states? What is Pennsylvania doing around suicide prevention? What is Illinois, Wisconsin, Minnesota, Michigan? And coming together to see how, what we can do as a collective in the Midwest to really put a focus on this, and to also learn from one another. So this will be coming up again, May 13th and 14th. I think I told the staff both went on vacation on the week of Thanksgiving and came back to this. So I don't know I don't think they'll ever leave me alone again to my own devices. But it is something that I think could provide a really, really good opportunity to not only highlight what Ohio is doing, but also learn from other states and be a champion in this, as a regional group to combat suicide prevention. So.
Yeah, I'm stressed, yes, of course, but I think that ultimately I am really excited about this. Especially opening it up to surrounding states and people. I think that connectedness is one of the primary protective factors when we're talking about suicide prevention, but I think connectedness can also be one of the factors that really helps push suicide prevention forward. And so connecting with other states, connecting with other counties in our state, all of that is going to be super helpful. So again, please put this on your calendar, save the date, and I'm going to be finishing up this call for proposals. So if there's something that you think, oh my gosh, I would love to present on this, I will be sending that out this week. I'm not going to promise today, but I'd like to get it today, but we'll see. So that's where we are with the conference.
And this is not to circumvent or discourage anyone from going to the Ohio State Suicide Prevention Conference. This is going to be a bit different. Ohio State looks at research and theory, and does a really, really good job of that. And I think is a really, I went to it last year for the first time and really found it helpful, and really helped develop some ideas. This is what we want to do, is have more of a practical, how can I actually utilize? We're coming out with a state plan in early 2019. In January of 2019, the state suicide prevention plan will be coming out. We'll be having a big press conference and releasing that to all of you, so that if you want to use, if there are pieces you can use in your community, we encourage it and and be able to help. But what we want to do is we want it to be more practical. Okay, what are some communities doing that, wow, I might be able to pick that up and do that in my community? We know that funds are limited. We know that we have limited funding. Volunteers who might have jobs or whatever. So we want to make this something that we can learn from one another. It will not have a whole lot of, quite frankly, a whole lot of research. I'm sure there will be some, but this is going to be what we call much more of a practical type of conference. So we really, are hopeful that folks will come to this, and again, not just be among their peers in Ohio, but learn from other states what they're doing, the successes they're having, and how can we adopt those successes here in the state of Ohio. And likewise, they learn from Ohio what we're doing, and be able to take that back for folks in their state. So didn't know, we're coming to the end of this. Please let us know, too, if this is valuable information about learning about the bills in the State House. Please let us know. If it is not, I don't get my feelings hurt. I've got an ex-wife, so I've had my feelings hurt before. Please, let us know if it's not helpful as well. If it, because we want to only do things that you find of value, and that you can find helpful in your work. So didn't know if there were any questions or anything.
Brandy just said, is there anything like this from an employment standpoint? She helps those get back into the community employment, but what happens if they have a negative time? So Brandy, are you asking, would there be any content at this conference for, along the employment standpoint, or what exactly? Okay, so at the conference, I guess it would depend on the proposals that we receive, but it's something that I think that I would welcome something like that at our conference for sure.
Yeah, we want to reach, how could we, how are some communities doing things with the healthcare, with healthcare professionals, with business owners, with veterans or first responders, the LGBTQ community. What are those practical things that people are doing to get into those folks that into those entities that normally don't function, or normally don't focus. Their focus is not suicide prevention. However, their employees or their workforce is often touched by it, either individually or as a collective. So, this would be a great opportunity to, if we get a proposal, to promote something going on around businesses. Also, if you would ever want there's something called, I think it's called, is it Working Minds, that both Austin and Michelle have been trained in, and it is frankly, kind of QPR for the workplace. So it's more employment focused. And, you know, anytime it's a free training, you know, I'd be more than happy to send Austin or Michelle up to or down wherever you're at in the state to do that. And, you know, if that's something of interest, please let us know.
And I'm going to type my email into the chat box for all of you, but you're also going to be receiving an email from me later, so you'll have my contact information that way. And if you have any other questions regarding Working Minds or this issue that's been brought up around employment and suicide prevention, please contact me, and I will do my best to hook you up with the right answers. Are there any other questions? It looks like we're kind of winding down. But again, I will be sending this out in an email. I will have the recording of this, which I have to say, I forgot to do my weird, awkward intro. I didn't record that. And I started on the slide where we started talking about what is currently in law in Ohio. So the content is all there, the introduction is not. But I will be sending that out to all of you. I am going to update my PowerPoint to reflect the correct number for the new National Lifeline, and I'll be sending that out as a PDF as well for everyone. And if it's helpful, and you can say yes in the chat, I can send you links and or PDFs of all of the summaries of the bills that are currently in the legislation right now. A lot of people find that helpful, and the analysis of it is a lot easier to understand than reading through the language of the actual bill itself. That can be quite daunting. So I can send that out with this email. There will be lots of links to click, so just be prepared, but I'll make it as easy as possible to look through. So yeah, I will be sending all of that by the end of today. And if there are no other questions, then I hope you all have a really wonderful day, and don't forget to take care of yourself, and if you have any questions, we are always available. So thank you so much, and you're probably going to get emails from us soon, so enjoy the rest of your day.